for joining us. Doly, go ahead.
Thanks so much. Good morning, everyone, and welcome. Thank you so much for joining me today, along with my colleague, Veronica Javier. And I'm so excited to be here, and I know that Andrea is joining us on virtually as well. But first, I want to start by acknowledging that we are gathered on treaty and traditional territory of the Haudenosaunee, the Wendat, and the Anishinaabeg, including the Mississaugas of the Credit First Nation, on the lands protected by Dish with One Spoon Wampum Agreement. I'm Doly Begum, your NDP candidate for Scarborough SouthWest.
And I'm Veronica Javier, NDP candidate for Scarborough Guildwood. Thanks, Doly. Hi, Andrea. I'm joined also by my friends and nurse colleagues, Genevieve and Janice. Thank you, ladies, for joining us today. You know, Doly, the Liberals and the PCs have cut healthcare, especially in Scarborough, leaving many feeling disrespected and neglected. Del Duca, for example, fired 1,600 nurses and paved the way for hallway medicine that impacted care and having had people wait for long periods of time for care even before the pandemic. And then, of course, in the past 2 years of the pandemic, we've seen Doug Ford make more cuts to healthcare, especially around Bill 124. And so with the Bill 124, with the wage cap, this opened up a vicious cycle of a lot of my colleagues in healthcare in the front lines, the nurses and healthcare professionals, feeling burnt out, feeling disrespected, as I said, and leaving the field. And then leaving a lot of my colleagues having to try to make do and make sure that patients and families feel supported and safe, but feeling very tired as a result of that. And as a frontline worker, I've seen how this has impacted families across Scarborough, with having also then to make do with limited resources that they've had to work with tired frontline staff, but still having to try to support them. And I've seen this on the ground and feeling it myself, having been deployed to different areas of Scarborough Health Network to fill the gaps and still continue to try to support the residents and families in Scarborough.
You know, Veronica, you as a healthcare worker have so much experience on the ground, and I have seen, growing up in Scarborough, I've lived in Scarborough, I've seen my father get the treatment more than 20 years ago, and I feel like that has deteriorated now. And it doesn't have to be this way. We could have been so much better. We could have invested in our healthcare system. We could have invested in our hospitals. We could have hired more nurses and doctors, and we wouldn't have faced the situation that we did during the pandemic. There was a lot of things that were missing during the pandemic, and I know what all of the healthcare workers, and I'm really excited that today we're joined by some healthcare workers who have been on the front lines. And when you talked about Bill 124, it doesn't have to be this way. We talked about healthcare workers being the superheroes during this pandemic, and yet Bill 124 was a slap on the face for so many who risked their lives to help people across this province, and yet did not get the appreciation and the pay that they deserved. I think about the people who shared their stories. There are so many. As an MPP, I shared these stories in Parliament as well. And when I knock on the doors, I hear from so many people as well. One of the stories that I talked about was from Betty, a senior citizen who lived in Scarborough SouthWest, and she had a brain surgery. And the fact that there weren't enough people to take care of her when she was being moved from her bed to the emergency vehicles to go back home, and all of that, and the way she felt. And she was, one of the things she said to me, Doly, if it wasn't for the healthcare workers, I don't think I would be where I am right now, but I know what they're going through. I hear from so many people who also during the pandemic had to be shift from to other places because we didn't have the capacity. We had one resident in Scarborough SouthWest who actually was moved to Ottawa, and unfortunately the constituent died. And now the family is facing charges for bringing their family, their loved one back. And this is the situation that we're facing when we talk about the previous governments, whether they're Liberals, whether it was the Conservatives. the lack of investment, but also the creeping privatization and the lack of human resources, doctors, nurses, and PSWs, which is why I'm so proud that Andrea Horwath is the leader who listened to the people of Scarborough, who listened to the people of this province, and we want to make sure that we're hiring more nurses, hiring more PSWs, hiring more healthcare workers, and making the investments that we need in Scarborough, in this province, to really care for the people in our province, really care for the seniors, for example, who did so much to build the foundation of this province, and understand how do we really build our healthcare system the way it should be. And so today I'm going to, Andrea, I know you're here, and I'm going to hand it over to you because I know that you've got some amazing announcement to make as well to make sure that we have the care we need in Scarborough.
Well, thanks so much, Doly, and thank you, Veronica, and thank you to all of those folks who have been over and over sharing their stories and talking about their concern about how much Scarborough has been ignored over the years. But the good news is we can get people care faster and at the same time help nurses recover from burnout by putting enough nurses on each and every shift. And in Scarborough, that means our plan will fill the whopping 186 nurse vacancies that you have now, and over the first term, add 1,200 new nurses to Scarborough's healthcare systems. And that's part of the 30,000 nurses that we're going to add all across Ontario. As I said, we all know that Scarborough's been shortchanged, and people have paid the price for that. Electing NDP MPPs like Doly Begum and Veronica Javier will get you your fair share of care faster. And just imagine how more nurses will fix healthcare for you and your families. Someone will be there to take a look right away when you bring your child into an emergency room. When you need surgery, you won't have to wait months and months and months, sometimes years, to be able to get that surgery addressed. And of course, with the backlogs that we have because of COVID, that's what's happening now. Our healthcare heroes, of course, have had a lot of, a lot on their plate. They've been stressed out, as we know. They've been burnt out. They're watching their colleagues leave, as was discussed by Doly and Veronica. But we can make sure that not only do we have enough healthcare workers to shore each other up and do a great job for patients, but also make sure that they have the time that they need and the time that they want to listen and to deliver the quality care that people deserve. There is hope that we can actually achieve this. But as was mentioned, Ontarians remember that it was the Liberals who gave us hallway medicine. It has been mentioned already. They fired 1,600 nurses and cut hospitals. And the Conservatives, of course, only made things worse. Doug Ford's cut healthcare before the pandemic, and we know very well he will definitely keep cutting healthcare if we give him the chance. We can't afford that. Ontarians can't afford more cuts. Scarborough can't afford more cuts. So if you want to fix healthcare, I want you to know that together we can do it. You just need to vote. Vote NDP in this election. Advanced voting, of course, is already on, and it's on until May 28th. So get to the advanced polls. You deserve a premier this time who's working for you. And I'm just really proud to be able to say that is myself and our team. And I'm looking forward to making real change that will fix what's been broken for far too long. I'm going to take some questions, but there's been something on my mind since yesterday, because yesterday we talked about gas gouging. We talked about how we're going to take on big oil. And of course, big oil and Stephen Del Duca and Doug Ford really did jump on us, saying that this can't be fixed and that our plan won't help in terms of gas prices. But I want to say to folks, it's not in their interest to support our plan. It's not in big oil's interest to support our plan. It's not in Del Duca or Ford's interest to support our plan, because they haven't done anything to address those oil and gas prices. They won't take on the big fish They won't take on the big fish in oil and gas. They won't take on the big fish in insurance. They won't take on the big fish in privatized home care and long-term care. The bottom line is there's only one person who, when premier, is prepared to take on those big fish and work in your interests, not the interests of the buddies, not the interests of big oil, not the interests of privatized healthcare services, not the interests of massive insurance companies, your interests. I will always work for you and for your interests. And I want to say, this is an opportunity to make that change happen. And you know what our friend Jack Layton used to say, don't tell anybody, don't let anybody rather tell you that it can't be done. It can be done. I will do it. And I'm looking forward to getting the opportunity to be fighting for you and be on your side as the premier of this province in a couple of weeks. So on that note, I'll certainly take any questions that folks might have.
Thanks, Andrea. We're going to go to questions on Zoom. I'll remind folks that if you have a question to please use the raise your hand function. You'll get one question and one follow-up. The first question is from Man Almidi from the Canadian Press.
Hi, Man. I can't hear anything.
I think you're still on mute.
So yeah, sorry.
Yeah, got you now, Man. Got you now.
Good morning. How are you? So I want to ask you about the cannabis industry today. So the former Liberal government had planned for only government-run cannabis stores in Ontario, while the Ford government allowed private businesses to sell this commodity, the cannabis. What do you think of each of these two approaches, and which one would you adapt if you were elected to government?
Well, it's a good question, Man, and I have to say that the most I hear about this particular issue is concern from communities and municipalities about the overtaking of business districts by this one type of retailer. We've had a private members bill in the legislature sponsored by Mark Stiles from the riding of Davenport, on behalf of the City of Toronto, who's got those kinds of concerns, as does my city of Hamilton, as do many cities. And I think that that's where I would start, to look at what has been the impact, what are people, communities, municipalities saying about the current model. And I'm not afraid to have a look at all of that. I think it needs to be done, especially when we know that there are some consequences that have occurred with the model we have now that are not sitting well with people.
Okay, thank you. As a follow-up, I think you were talking about the issue of clustering, where like several businesses kind of open in one area and one small area, each next to each other. How would you address this, especially as you said, like we have areas like downtown Toronto, downtown Hamilton, York region, where we have many businesses, cannabis selling businesses, and where in other areas we don't have any businesses that are part of this sector. So how would you address the issue of clustering in this growing cannabis sector?
Well, a big part of the way I always do things is to have the discussion, and that's what I'm committed to doing. I've heard from too many municipalities that there are serious concerns about how this all played out. Doug Ford put in a system ignoring the voices of municipalities, because that's who Doug Ford is, and that's left some real problems at the local level. So the way to solve those problems is to engage with those folks, those leaders, and start to figure out how we can fix the things that are broken.
Next question, we have Wyatt Sharp from the Wyatt Sharp Show.
Hey, Wyatt.
Hi, Andrea. Hope you're doing well and overcoming COVID quickly. Just a question. You mentioned the price of gas in your opening remarks. I guess just Liberal leader Stephen Del Duca, he was in Curtis last night where he spoke with supporters, and numerous times in his speech then he reiterated the Ontario Liberals' plan to lower the gas tax. Obviously, Doug Ford has said numerous times that he would do the same. Obviously, the NDP would cancel the cut to the gas tax. Just where would you reinvest some of that money?
So first of all, the plans that these two guys are bringing forward are not going to take on oil and gas companies. They're not going to take on big oil. And that's what my plan does. because they don't want to take on big oil. In fact, Doug Ford had several meetings back in 2019 with big oil companies, and not once mentioned the price of gas and how that impacts people, everyday people in their communities. And so, what I'm taking a completely different tact from them. I'm saying I will tackle big oil. I will regulate. I will cap gas prices at the pumps and stop the gouging. That's what needs to happen. Doug Ford and Stephen Del Duca, their plan will give people a couple of bucks for 6 months. It won't make a lasting impression. And the other thing we know, look at Alberta. They don't have any gas taxes, but they have the highest prices of gas that they've ever had. So if we do what those other two guys are saying, first of all, it's not much of a break. It won't last. And second of all, big oil will just move right on in and increase prices to take up the space that the reduced gas tax would create. So I think these two guys just continue to refuse to work for everyday people, as opposed to their buddies and interests in the oil and gas companies.
And I know you get asked about strategic voting quite a bit as to where progressive voters should go, but new polling data came out this morning in which the NDP was slightly ahead of the Liberals and Stephen Del Duca. So I guess just what's your final pitch? I mean, we're getting closer and closer to Election Day as the days go by to progressive voters in the province of Ontario, and whether or not, someone who's on the fence between one of the progressive parties should vote for the NDP and why.
Thanks for the question, Wyatt. I think it's pretty clear. Today we're talking about how healthcare is broken in Scarborough. It didn't get there just over the past 4 years. Healthcare is broken in Scarborough because 15 years of the Liberal government broke healthcare. They froze hospital budgets, they cut hospital budgets, they fired nurses, and Doug Ford is doing the exact same thing. And if we let him, he is going to continue to make big cuts and privatization in our healthcare. So, I get it. People go back and forth, liberal, conservative, conservative, liberal, but nothing changes for everyday people. And life doesn't get better. And the things that we all care about don't get fixed. How can you trust people? How can you trust parties and leaders to fix the very things that they broke in the first place? I think that's what I'd like people to give a little bit of thought to. And I can guarantee you that when I'm the premier of this province, it'll be you. It'll be everyday people who will be top of mind for me. I will work for everyday people, not big oil and gas, not big companies, small mom and pop stores for sure. Unlike Doug Ford, who favored, the big Walmarts and companies like that, big box stores over mom and pops during the pandemic. We know whose side Mr. Ford is on. We know whose side Mr. Del Duca is showing he's on. I've always been on the same side, your side.
That concludes the questions that we have. I'll turn it back over to you, Andrea, for closing remarks.
Thanks very much, everyone. You can hear my voice is a bit scratchy, but I'm hopeful that I'll kick this virus to the curb as soon as possible and get back out to see people in person instead of, in the confines of this space that I'm in now. But I do want to thank Doly and Veronica, as well as the healthcare workers that were with us this morning. I want to end just by saying this. We've seen for years and years and years the people of Scarborough being left behind, and we know that we can fix that. And that's what we're hoping to do. So again, voting is open now. The advance polls are open until the 28th of May. Please go and mark your ballot for your NDP candidate, including Doly Begum and Veronica Javier. Thanks, everybody.